Hi, since June is Vitiligo Awareness Month, it's very important that I talk to you about a skin condition which is considered to be a huge social stigma, and that is vitiligo, or in Hindi, many people call it Shwet Kusht ya Safed Daag. Now, the taboo associated with this disease is so much so that many people tend to isolate vitiligo patients not because they have some contagious illness or some life-threatening disorder, but just because they have a cosmetic issue. So this needs to be discussed. Now, 5 facts about vitiligo. First, vitiligo is derived from the Latin word vitilis, which means pale pink flesh of the calf. Second, this disorder is characterized by loss of skin color in an irregular patchy pattern leading to milky white colored patches over the body. Third, it can occur in any part of your body, including the inner lining of your lips, genitals, etc. Fourth, the familial incidence of this condition varies between 20 to 25%. Fifth, most of the cases present between 2nd to 4th decade of their life, but it can actually occur at any age. 5 more facts about vitiligo. If we talk about the cause behind it, the main cause is considered to be autoimmunity. That is, the body produces antibodies which attack the color producing cells of the skin, that is melanocytes, leading to these milky white patches. Second, this disease is gradually progressive, but at times it may remain quiescent for years. Third, the hair in this area affected by the white patches is frequently normally colored, but in older lesions, the hair may also lose the color and become white. Fourth, this condition may show spontaneous repigmentation in 10 to 12% of the cases. And fifth, there are a number of treatment options available for this condition, both medically and surgically. So it's time to burst certain myths regarding vitiligo. So the first myth is that patients of vitiligo are born with this disease because they have mixed race parents. Now this is completely untrue. Vitiligo is not associated with any ethnicity, and humans of any race, caste or creed can develop the disease. Most of the patients are born with normal skin pigmentation and develop the disease after some time, usually before the age of 20 years, but it can actually occur at any age and then it progresses further. Another myth that vitiligo develops only in young patients. Now, vitiligo is a progressive medical condition which is usually seen to develop between the age of 10 to 30 years, but it can actually occur at any age and progress further. Now, the next myth about vitiligo is that it only occurs in people with darker skin tones. This is not true. It can actually occur in an individual of any race, but it is more noticeable in people who have darker skin. So another myth is that vitiligo is a form of leprosy, that is Kusht Rog, and hence is contagious. Now this is not true. Vitiligo is not a contagious disease. It is a non-communicable condition which is caused because of a number of underlying factors, main being autoimmunity, while leprosy is a completely different condition which is caused because of a bacteria. So since it is a non-communicable disease, you do not need to distance yourself from a patient who has vitiligo. So a myth about vitiligo is that it develops only in sun-exposed areas. Now this disease may initially appear in the visible parts of the body, but then it can actually occur anywhere on your body, including the armpits, genitals, buttocks, covered area, bony prominences, anywhere. Moreover, it can also involve the mucosa, that is the inner lining of your mouth, genitals, nose, etc. Now the hair in these depigmented patches are initially normally colored, but over time, if the condition remains untreated, then even they may lose their color and become white. A myth about vitiligo is that vitiligo patients eventually develop mental and physical disabilities. Now, this is not true. These patients do not suffer from any mental or physical impairment. They just have a cosmetic disability. But this condition may be associated with other autoimmune conditions like thyroid disorders, diabetes mellitus, pernicious anemia, that is, there is a decrease in the red blood cell count due to vitamin B12 deficiency, or alopecia areata, which is patchy loss of hair, or atopic dermatitis, which is a form of eczema. So these patients need to be referred to a dermatologist to rule out all these conditions properly. Now there is a myth regarding vitiligo that it develops after consumption of certain food items like white colored food items like milk, sugar, salt, or after consumption of citrus fruits like lemons, oranges, etc., or after consumption of milk immediately after eating fish. Now all these things are completely baseless because vitiligo has nothing to do with food consumption. Another very common myth about vitiligo is that it develops in a person who has received a curse after murdering some saint in his previous life. Now this is not true. Vitiligo develops because of a number of internal factors, the main being autoimmunity. It has nothing to do with your past life or any curse. There is a common myth that vitiligo runs in family and all the children of a vitiligo patient will develop the disease, so you should not marry the children of a vitiligo patient. Now this is not true. Not all the family members of a vitiligo patient develop the disease. There is, say, 20 to 25% chance of a child to get the disease from his or her parents. But that does not mean that you outcast the entire family just because a family member has a cosmetic issue. A myth about vitiligo is that there is no treatment available for this condition and so the vitiligo patient should just be isolated. Now this is wrong. A number of treatment options are now available for this condition which will help to treat and check the disease progression. These include both medical line of management, surgical line of management, and light-based devices. So, do not isolate the vitiligo patients. Instead, refer them to a certified dermatologist.